Today we discuss an aging face. Everyone is scared of getting old, but there are ways and there are means on how to reverse that aging. And that's why cosmetic surgeons are there to help you out. Today we'll discuss one of our patients. I won't say the exact age because females are very concerned about their ages, but I'll identify what are the aging changes, the signs that you can look for. And when you are planning for aesthetic or cosmetic treatments, what should you look at? What do we notice when we look at people? Whenever we look at someone unconsciously, we look at a few things. We look at their age, we look at their social status from their get-up, and because based on that, we decide our response. That all happens unconsciously. So how does the human eye determine the ages of the person that we are talking to? If we're talking to a kid, automatically our tone softens. If we're talking to someone of a higher age, then we are more respectful. If you're talking to someone of our own age, we are more friendly. That's something that happens at the back of your mind. And it happens because there are certain key things that happen with aging. In this patient, the first thing, the sign, there are certain two important factors. One is the sagging of skin. Second is the volume loss. These two things play a key role in an aging face. So, because of sagging, everything comes down. Because of volume loss, cheeks go in, and there is volume here just above the nasolabial smile lines, and there is volume here in the jowls, and there is sagging of the skin in the below the chin that people are very concerned about. It can accumulate fat and lead to what we call the double chin. In some people, because of aging, you can have a turtleneck. All these things together contribute to aging. There are wrinkles here, there are wrinkles here, there are wrinkles here, there are deep wrinkles here, and deep wrinkles here. That together makes a sad smiley. It also affects the jawline. There is no shape. Youth is always triangular. That's why people want a chiseled jawline. They want a V face because that is youthful. With age, this V becomes U. That is the main difference in a young, youthful face and an aging face. Now, in this patient, I would identify, when you look at her, she has deep nasolabial lines, deep smile lines. Some people have them less, some people have them more, but that is one of the first signs of aging. And since it's in the central face, we look at it whenever we are talking to a patient, whenever we are talking to anyone, we assess the age. Second, she has a double chin, a big chin. She has extra skin and she has extra fat in there. Because of that, she has lost the definition of a jawline. Even when you look at the side profile, she doesn't have this jawline bone. It's there, but it's not actually obvious. Next, there is drooping of the eyebrows. They're coming down. Everything sags as we age. And the best treatment is lift them up. That's why we say brow lift. That's why we say facelift. That's why we say breast lift. Whatever happens with age, it happens because of aging and because of gravity. Everything sags. We want to lift them up and hitch them in the lifted position. So in this patient, with all these signs of aging, she was not happy. And I did a complete surgical facelift. I did a smash lift in this patient. I did liposuction of the jawline to contour and chisel it. I did elevation of the eyebrow because she was very concerned about these droopy eyelids. So together with these procedure, it was all done in a single surgery. And I also added Botox for the forehead lines. And this came up with an incision here inside the hairline and then extending here behind the ear. And it went on and we lifted everything up and we hitched it. That's the surgical facelift. You can see the transformation. She has completely changed look, and now she's very confident about herself. She looks 10 years younger and she looks much, much happier. So cosmetic surgeries, the facelift, it's something that you should do for yourself. It's not for others that you go around asking people. I get people who come in for consultation with their friends and relatives. They come in and ask me, what should I do? No, no, you should look at the aging signs. If they bother you, we have the treatment for it. We do the treatment to make you happy, to make you confident. Do not do these for others. They're all for you. You feel young, you feel youthful, you feel happier, and you feel confident. These are the things that I aim for. And this patient in this scenario, she's very happy with the results, and I'm very happy with the result. Now, since this is a big, big transformation, it includes a lot of different things: eyebrows, cheeks, jawline, smile line, jowls, double chin. This would spark a lot of questions in your mind. Drop them in comments. I'll be happy to answer them. Stay confident, stay youthful, and take good care of yourself.